Hi, today I will be demonstrating extubation. I will verify the physician's order and evaluate indications for the patient assessment. I would, which includes the reversal of underlying indication for intubation. I review the patient's chart for any significant findings, such as arterial blood gas, last time they had that done, the last time they had vasal pressures. I will now identify my necessary equipment. For extubation, it will be a chuck, small volume nebulizer, which is racemic epinephrine, a Yankauer, 10 milliliter syringe, gloves, manual resuscitator, my oxygen source, my suction source, my stethoscope, and my closed suction catheter. For the intubation tray, it will be a commercial endotracheal tube holder, endotracheal tube, my oxygen source again, which includes my large volume nebulizer, corrugated tubing, my mask, aerosol mask, my suction source, which includes the Yankauer, lubricant, nasal, nasopharyngeal airway, oropharyngeal airway, stylet, batteries, another 10 milliliter syringe, the straight Miller laryngoscope holder, blade, the Macintosh laryngoscope blade, my Easy Cap, inline suctioning, my suctioning kit, and that'll be it. I will now set up my oxygen and aerosol delivery device, which is a large volume nebulizer. Which is a corrugated tube and the aerosol delivery device. I will turn it on to 10 liters per minute and make sure that aerosol was happening. There's aerosol presented at the time, and the large volume nebulizer will be at the same FiO2 as the ventilator. I will now wash my hands for at least 15 seconds. Hi, my name is Tanika. I'm from Respiratory Care. May I please have your name and date of birth? Okay. So today I'm going to be suctioning you and removing your tube today, okay? So if that's okay with you, can you please squeeze my hand? And while I'm doing that, while I'm suctioning you, I'm going to ask you to take in a nice deep breath, okay? Okay. I am now going to place the patient in a high thyroid position, and that is 90 degrees. Okay. While the patient's in 90 degrees, I will check the patient's breath sounds, heart rate, saturations, blood pressure, respirations, and color. I will now apply the chuck. I will turn on my suction. I will now turn on my suction unit and make sure that the vacuum's at negative 120 to negative 150 centimeters of H2O. I will now attach it to the clothesline suction machine. I will pre-oxygenate the patient to 100% FiO2. I will now tell the patient, I will now be suctioning you, okay? 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi. I will now just touch. I will now suction Mr. Jones. I'm not going to suction you. I'm going to suction the oropharynx and hypopharynx to remove secretion above the cuff. Okay, good job. I now going to hold the endotracheal tube, and I'm going to remove the commercial endotracheal tube holder. All right, Mr. Jones, when I tell you to take a nice deep breath, okay, take a nice deep breath. All right, good job. While he's taking a nice deep breath, keep coughing, cough for me. All right, keep coughing. I am now going to suction him. Once I am done suctioning him, keep coughing. That's good, you did good. I am going to apply my large volume nebulizer. Once I am done applying my large volume nebulizer, I am going to listen for breath sounds. I'm going to listen for stridor. I'm going to listen for stridor and listen for bilateral equal breath sounds. If stridor was presented, then I will use my small volume nebulizer and give racemic epinephrine treatment. I will now assess the patient's blood pressure, heart rate, saturations, respirations, and color. I will now clean up my mess, wash my hands for at least 15 seconds, and document the patient's chart.